If I got to go to college, oh my goodness. I like discovering new things. You get to see what works for you and what doesn't. That helps you evolve as a person. You get to make like a supernova of skill or talent or whatever it is. I've always wanted to go to college. I just feel like that's my destiny. My name is Queen, and I am your dividend.
Well, open enrollment is the time in Medicare where you have the opportunity to make changes in your Part D drug plan or your Medicare Advantage plan. It started on October 15th and we have until December 7th, and that's the last day that you can make changes up until next year around this time. So it's important to make any changes by December 7th.
No, they don't have to change their plans, but each beneficiary received an annual notice of change that tells them what their plan is going to look like next year. And so there are certain critical pieces of their plan that they should check to make sure that, for instance, all of their doctors are going to be there, all of their medications will be covered, that they will be able to afford to pay the premium if it goes up, or the co-insurance or co-pays that are connected with Medicare services. A formulary is the approved medication list, and each prescription drug plan has a formulary that it has approved. So we now, in 2015, will have 31 standalone prescription drug plans and many more attached to the Medicare Advantage plans. Someone would need to make sure that all of their medications will be covered by their plan, or switch to another one that will cover the medications if their current one will not next year. In that annual notice of change, they will also get a list of those drugs that have been removed from the formulary and any drugs that have been added to the formulary. They will want to check those two lists first to make sure that none of their drugs are in that removed list. And they probably then can be pretty certain if their drug is not there, then they will all be covered. But to be even more certain, they will want to check the formulary that comes with the annual notice of change. Also, the Medicare website, and Emily, why don't you tell them about that, also can cover their drugs.
Sure, absolutely. The Medicare website has a portion of it called Find a Plan. And under this portion of the website, you can enter in all of your prescription drugs, including their dosages and which pharmacy that you prefer to use. And then the website will generate a list for you of all the different drug plans and Advantage plans and how much each one of your drugs would cover or would cost under those plans. A lot of people use OSHIP for assistance, which is the Ohio Senior Information Insurance Program. And so they have trained counselors who can help people navigate the websites and help them find the information they need about their Medicare plans. And so Semanthie and I are both OSHIP trained counselors, and we have other counselors at both of our organizations, and we're happy to help anybody go through their plan.
Yeah, we'd like to let people know that there is a real local resource for them in addition to OSHIP. The City of Cleveland, as Emily has indicated, can provide that assistance if someone calls their number. Also, the Benjamin Rose Institute has a Medicare and benefit enrollment call center, and people can also call us if they want a real local kind of help. Absolutely. Medicare provides what they call LIS, or low income assistance, also known as extra help. And again, individuals can go online to apply through the Social Security Administration. But for older adults who may not have access to that kind of information, they again can call the City of Cleveland or the Benjamin Rose Institute on Aging, and we will be able to complete that application for them online. That assistance can save them up to about $4,000 a year, where most people will not pay any more than $6.50 this year for their medication, and as low as $0 if an individual is in a residential facility or assisted living.
So there are 2 or 3 ways to sign up. One is by going to Social Security's website and filling out the application there directly. You can also call Social Security and request that a paper application be sent to you, and they'll send it to you, you fill it out and mail it back in. You can also apply over the phone through Social Security, calling them directly, and they'll ask you a series of questions, and that'll start the application process. And again, you can always call Benjamin Rose or the Cleveland Department of Aging, and we can help with that process as well.
It is against the law for anyone who knows that you are a Medicare beneficiary to sell you a marketplace plan. And so older adults and adults with disabilities who are receiving Medicare need to be very clear that they already have a very good insurance plan with Medicare that covers also prescription drugs. And they need to utilize one of the resources that we just talked about, OSHIP, the department, the City Department of Aging, or the Benjamin Rose Institute to find out more about Medicare insurance and the prescription drug benefit plan for them. Ohio has, as a few other states, are participating in a demonstration for integrated care. In Ohio, we are calling our demonstration My Care Ohio. And so those individuals who have both Medicare and Medicaid are already participating in a My Care Ohio plan, which is CareSource, Buckeye, or United Health Care. They have recently received a letter from the Department of Medicaid saying that Medicaid will now include their Medicare benefits starting January 1st. If individuals do not want to include their Medicare with My Care Ohio and keep it just as it is today, they must call a 1-800 number that was included in that letter to let the state know that they want to keep their Medicare exactly the same as it is today, or opt out of My Care Ohio for their Medicare services. Their Medicaid services will continue to be provided through this demonstration.
Anybody can call the Cleveland Department of Aging. Our main phone number is 664-2833, and we can talk to you about what your questions are, what your needs are, which plan you have now, which plans you're interested in. We can really help you sort through those options. You can also call the Benjamin Rose Institute.
And our telephone number is 216-373-1650. But in addition to our 2 agencies, an individual can go directly to Medicare and call the 1-800 Medicare number for assistance, or as Emily indicated earlier, they may call Social Security for information about the low-income assistance, or they may call OSHIP for additional assistance about both Medicare and the prescription drug benefit.
It's important to know that you don't have to figure out Medicare alone. There are many people out here who are ready and wanting to help you.